Let's start with what we mean by irregular periods. A typical menstrual cycle ranges between 21 to 35 days, and your bleeding can last anywhere from 2 to 7 days. But if your cycle changes month to month, or you skip periods, bleed more than once a month, or go months without a period, that's considered irregular. While 1 or 2 off months may not be serious, frequent irregularities may indicate an underlying issue. There are many causes of irregular periods. The most common one is hormonal imbalance, often involving estrogen and progesterone. This can happen during puberty, perimenopause, or even due to stress. Another major cause is polycystic ovary syndrome, PCOS, where hormonal disruptions lead to missed or unpredictable cycles. Other factors include thyroid disorders, rapid weight loss or gain, intense exercise, and eating disorders. Even chronic stress, travel, or sudden lifestyle changes can impact your cycle. Women with diabetes, insulin resistance, or high prolactin levels may also experience irregularity. So, what can you do about it? First, don't panic. Start by tracking your cycle. Use an app or a simple calendar to note the first day of bleeding, how long it lasts, and any symptoms. This helps spot patterns and gives your gynecologist valuable insight. Next, review your lifestyle. Are you getting enough sleep? Eating regularly? Under chronic stress? Small changes like improving diet, reducing caffeine and sugar, sleeping well, and managing stress through yoga or deep breathing can often bring your cycle back on track. Medical solutions are also available. If lifestyle adjustments don't help, your doctor might recommend blood tests to check your hormone levels, thyroid function, or insulin resistance. Depending on the cause, treatment may include hormonal therapy, like birth control pills, progesterone supplements, or treatment for underlying conditions like thyroid disorders or PCOS. Natural remedies like Vitex, chasteberry, or magnesium. Supplements are also being explored, but always consult a healthcare provider before starting anything new. When should you be concerned? If your period disappears for more than 3 months and you're not pregnant, if you bleed between periods, or experience very heavy bleeding, see your doctor immediately. These may be signs of something more serious, such as fibroids, endometriosis, or hormonal dysfunction. If this video helped you understand your cycle better, I'd love for you to subscribe to Dr. Emily Cares. Don't forget to hit the bell icon so you never miss an important women's health update. And share this video with someone who might be struggling with her cycle, because understanding our bodies is the first step to healing them.